what we have done basically is that we have standardized the treatment based on diagnosis. Diagnosis not in a way the homeopath classically diagnoses an individual, but the way the allopath or the conventional doctor diagnoses a disease. So now if you bring 5 patients with the same disease to any doctor in our clinic, they will prescribe the same medicine in the same potency and in the same dosage pattern. So that is the Banerji protocols. With a collective experience of say 150 years, our family has been into homeopathy for the last 150 years. We have been harvesting the results of the treatment and we have focused this into solid data accrual, and due to the data accrual, we are being able to actually now even further fine-tune the treatments and to arrive at the protocols that we practice.
Lung cancer, which you are showing that. Suppose I have seen 1,000 lung cancer cases in life. Then what we saw, that during these 1,000 cases of lung cancer, how many cases have been benefited, how many percentage of cases have been benefited with the medicine. The maximum percentage of benefit by a medicine or a group of medicines are the specific for that disease, particular disease, which was not there before in homeopathy. We have identified the diseases when it came up during our practice lifetime. We uplifted homeopathy to that observation. That is the Banerji protocol. So we have observed that maximum number of cases, certain disease, maximum number, suppose 70% cases are benefited with a protocol of medicine. We made it a Banerji protocol. Very difficult to say. See, there is a lot of interest also if this about Banerji protocol type of treatment comes up in the front, then a lot of treatment will be very cheap, economical, and the drug companies will suffer. That maybe that's one cause that they don't want that these type of treatments should come up to the surface and give relief to the patients. Because drug industry is a mammoth industry, billion-dollar industry around the world.
There is a lot of confusion about research, about the different layers that authenticate research. What you talk about when you talk about a conventional drug, for example, you are creating a new drug for chemotherapy. So this drug is a drug which has never been used before. So you take this drug, you start right from the grassroots. You start from the laboratory, you test it on culture media, you test it on different other drugs and to get the reaction. Then you test it on cancer cell lines, and then you go to the mouse, then you go to the guinea pig, then the animal trials, and then you go to the human being. So the process of doing this is actually necessary in a medicine, in testing a medicine which is absolutely new and has no historical background. Now, when we say that a drug, Kali carbonicum, is good to treat lung cancer, Kali carbonicum has been in use for 200 years already. Every system of medicine is different. Ayurveda has so much of history that it is lost in history. That we don't know when Ayurveda originated. It is so old. If you use the same parameters that you use to test conventional medicines, like you start in the lab and you go to the mouse and then you go to the human being, have you done a clinical trial on this? The first question that any research-oriented body asks is, have you done clinical trials on this? You see, the problem is that going back after treating human beings for 200 years with those medicines, it is already killing cancer cells in the human being. We have ample evidence that these medicines work. Now, there will always be a difference or a gap between acceptance in the scientific community because of this fact. Every system of medicine is different, and these differences need to be taken into account when you evaluate a system to be used. If you apply for a grant, financial aid to do research, you will always be refused because they will judge the grant system is such. It always takes into account the conventional allopathic way of examining a drug. The homeopathic medicine, it is so dilute that there is no instrument as of today to be able to measure the presence of the drug substance in the medicine. In that respect, how can you say what is the active principle in the medicine? You cannot say. If you cannot say what is an active principle in the medicine, there can be no clinical trial. Because what are you testing? What needs to be done is evidence-based support for a system of medicine which has already survived 200 years. In our database right now, we have 40,000 cases of cancer with 500,000 follow-ups. So the cancer case comes, is registered, treatment is started, the whole symptomatology is noted, and then when the patient comes back to report as to how they are feeling after taking medicines, even that is recorded. So in that way, 500,000 follow-ups are there for 40,000 cases. So this data puts us in a very privileged position because of the Banerji protocols. When a patient comes to us with a physical disease, for example, a patient is suffering from typhoid. Now we have a diagnostic approach. So it's a typhoid fever that is caused by Salmonella typhi, and it produces 7 days of step-ladder rise of temperature, and then there's a plateau where the temperature is extremely high, it lasts for 7 days, which lasts 14 days, and then there's a step-ladder fall for the next 7 days. So 1 month of illness is a natural history of typhoid. Okay, so we have a patient coming with us with typhoid. See, in that scenario, we have treated so many typhoid cases. We would not bother so much about the mental symptoms unless there is something remarkably visible to us, or there's something remarkably mental about the case. Now, supposing the typhoid, when the fever goes up, the person gets so much afraid that he hides under the bed. That would be a marked mental symptom. Maybe we would consider the symptom then. But if a person comes with a mental problem, if the person comes with schizophrenia, or if the actual complaint is the disease, for example, says, "Doctor, I'm in a constant state of fear. I'm afraid to wake up in the morning, I'm afraid to get up from bed, I'm afraid to go to the restroom, I'm afraid to meet people." If that is a complaint of a patient who comes to see me, then we would focus on the mental symptoms and treat it as a case that required a psychiatric outlook. And we would treat the patient according to the psychiatry of it. But if a patient is having a cough and cold, and that's it, has come to us, we would not ask mental symptoms of that. We have mental disease, we treat mental disease. In fact, the world is turning such that there's too much of mental disease around anyway. But we are treating mental disease as a mental disease.
A science in the beginning is like some information was there. In the course of the time, science has improved to a certain level of height. So everybody should equip themselves to the present day science, take all advantages, and to homeopathy also, and to treat the cases with at par the present day science.